we're talking about the importance of women's health during National Heart Month with Danielle Gaskins and Bonnie Hibbs with Baptist Health today. Thank you so much for being here. We were all wearing red on Friday for Go Red for Women and Heart Health Awareness. This is so important that we talk about this. What's the message that you want folks to know?
We just really want folks to know that this is going to be an open event. It's a safe space for women to come in, get some great information from a panel of specialists that we have within Baptist Health Louisville, and also just Louisville as a whole. And also we just want them to walk away feeling like they're more confident in the care that they should receive during their maternal health stages.
And that's what, I'm glad you mentioned that, because you have an event coming up, and that's what you're trying to bring awareness to. What is this event, and where is it taking place, and when?
Okay, so the event is going to be this Wednesday, February 8th from 5:30 to 7, and it's going to be at the Chestnut Street YMCA, 930 West Chestnut Street in the ballroom. This event is going to be a community conversation. It's the third annual one that Baptist Health Louisville is doing in partnership with the AHA. And this is going to be a panel-style conversation where we've come up with a great list of questions to ask our panelists to address the different community needs within the community here at Louisville. And we're also going to be doing some different giveaways. We're going to be providing a meal. We're also going to be doing some infant CPR demonstrations and also providing some blood pressure checks.
I know when you're kind of going through that pregnancy phase, it's all overwhelming, right?
Very much.
Yeah, it's kind of your body's changing in so many different ways. Maternal health and heart health, how does that kind of go hand in hand?
Yeah, so maternal health encompasses that time during pregnancy, childbirth, and the postpartum period about a year after. Very important that we talk about maternal health because so many times pregnancy is very hard on the body and stressful, and complications can occur. So in the United States, maternal mortality and morbidity is actually higher than most developed countries.
Which is shocking.
Shocking. And the leading cause of maternal mortality is cardiovascular disease, which is why we're shining a light on that this month in February. Most women, if they can get care and get early access to care and also to see their providers and be able to get routine checkups, we can have better health outcomes. And that's what we want, right? We want healthy moms and healthy babies. So we're trying to, through this event, reach out to the community, educate them on the risk factors of pregnancy and also the resources available so that they have good outcomes.
And is that link there between maternal health and cardiovascular issues, is that linked because of what our bodies are going through when we're pregnant, or what's the reason for it?
Absolutely. Pregnancy can be a high risk factor for cardiovascular disease just because of the increased blood volume that women have and the hard work that the heart has to do in order to pump that volume throughout the body.
So there's going to be a variety of panelists that are going to be talking, including gynecologists. You're going to have a psychologist there, dietitians. What are people going to walk away learning from and hearing from the event?
Yeah, so what we really want to talk about is all of the high risk associated with pregnancy, including heart disease, hypertension, diabetes. We'll have dietitians there to talk about nutrition, diet, what things you should eat when you're pregnant and what things you should avoid. And then also mental health is a huge issue.
Yes.
And what are the resources out there, and what can we do with depression? And then at the end of the program, we'll have a time for those who are attending to ask the panelists questions and be able to ask anything they want in related to maternity.
Danielle, also Baptist Health sponsors a variety of community conversations in collaboration with American Heart Association. Why are these events just important for our community?
Of course, events like this are so important for our community because not only does it give us a chance to connect with the community, but it gives us a chance to give back. We have so many resources within Baptist Health Louisville that is there for the community. So doing things like this, we are able to go in and find out the needs that the community has or any barriers that they're facing, and we can find better ways to address them.
All right, so what would you say to encourage people to come to the event? Because there's probably, I know when I was in that pregnancy phase, I was trying to learn as much as I possibly could, taking classes. I took classes at Baptist, I remember that, and they were very helpful. Why would you encourage somebody to take part in the event?
Honestly, I would say that this is truly a safe space for all women. We want you to come in, feel like you can ask questions, feel like you can get this information.
There's no dumb
Possibly-
question, right?
No.
Every question is welcome, honestly. Anything. And if you don't even feel comfortable asking that, our specialists are prepared to even stay after the event. And, you know, if you want to pull them to the side and have a one-on-one, they're prepared for all those things. So we just want it to honestly be a safe space where they can walk away just feeling confident in the type of care that they should receive.
And not only are you focusing on mom, but also focusing on baby as well. Talk to me about that.
So all of these things that we are worried about with risk factors and high-risk pregnancies obviously not only affect mom, but can affect the baby. So making sure that women get that care they need is so very important to make sure that baby comes out healthy. And that is, you know, again, our primary goal here.
And you were talking about mental health and how that all coincides with all of that. We're talking about mental health more because I think it's becoming more acceptable to talk about mental health, but the toll that a person goes through when they're pregnant, you're not only worrying about yourself, you're worrying about your baby, all of the things that you feel like you don't have control over.
Right, yeah. So mental health is such a big piece of the picture, right? So it's not just physical, it's also emotional, mental, and there are resources out there I think that women aren't aware of, and that, you know, we want to make them aware of so that they can go out and get the help they need.
Okay. So the event is coming up Wednesday. Danielle, can you give me the details one more time?
Yes, of course. So the event is going to be this Wednesday, February 8th, at the YMCA Ballroom on Chestnut Street. The address is 930 West Chestnut Street, and it's going to be from 5:30 to 7 p.m.
All right. Do folks need to register ahead of time? Can they just show up?
No pre-registration is needed. We just need you there.
Yeah. All right. Thank you
Just
so
show
much
up.
for being there here
You're
for
very
us. Is
welcome.
there anything I didn't ask you, ladies, that you feel like our viewers need to know about today?
No, just come and be part of the event. We
All
would
right.
appreciate it.
Great. Thank you so much for being here. All right. Coming up next.